Hi, I'm Casey Claypool. Welcome to Empire Eye Physicians. We wanted to show you some of our clinic today and how we work up our dry eye patients and incorporate them into our evaluation for cataract surgery and LASIK. So welcome. Often we think that the 40 to 50-year-old female is the patient that has dry eye or MGD. But it's amazing how many younger patients will have it, but we have to diagnose it. And how many older patients have it, but we just think it's normal aging. So as we evaluate our patients and talk with them, it's important to have conversations about when they notice symptoms and what their symptoms may be, and to correlate it with their visual outcome, whether they're having cataract surgery or LASIK or just frustrated with their contact lenses. It's important as we are preparing patients for surgery that we look for Meibomian gland disease and we have a discussion with them. It's also important to know what we're looking for.
You know, for our surgery patients, it's just so critical that we do a complete evaluation of the tear film before we make our surgical plan, and certainly before we operate. We're really fortunate that we have a really dynamic team of people working together for management of the dry eye patient and Meibomian gland dysfunction.
I believe Meibomian gland dysfunction is the most underdiagnosed and undertreated thing we see in our chairs every day. And so when I first came here from the Air Force, Dr. Kontos and Dr. Sturbaum, they encouraged me to launch a dry eye practice. So I did with enthusiasm. We incorporated, our first technology was Tear Science's LipiFlow. And it was important to evaluate the patient tear film and then be able to diagnose and treat that condition. We had patients driving from 6 hours away that would come to find us because they were so miserable from their ocular comfort. So for our patients that present to the office, when they come in, as soon as they come to the autorefractor, we have a meibographer sitting right next to it, the LipiScan. And we found it's very helpful for our surgical patients to analyze them before surgery. And so we always like to image the glands with Meibomian gland evaluation. And this will show the patient's structure. We have a TV here where we can show the patient what their glands look like and how the structure appears. It's very helpful to show next to a scale of normal, mild atrophy, and severe atrophy where the patients fall on that scale. So when I'm evaluating patients, I use Tear Science's Meibomian gland expressor. Meibomian gland expression, I believe, is a critical component of thorough eye exams. It's important to make sure you are evaluating the eyelids, not just the cornea and the conjunctiva. I had so many patients that are struggling with Meibomian gland disease, and now that we have this better understanding, better technology, I can educate patients and treat them so much more effectively by treating the cause of their disease, which is usually Meibomian gland obstruction. So by unclogging their Meibomian glands, the patient outcome is so much more successful.